Everything ready?
Yes.
Okay, I'll call the meeting to order of the Todd County Board of Commissioners on December 1st, 2020. The public is not allowed to attend in person. They're able to live stream through the address provided to you. And attending in person today will be Lauren Feldbaum, Public Works, Milani Marcy's Chief Deputy Sheriff, Chris Hodden, Assessor, Catherine McIndents, Health and Human Services, Sarah Ogren, Human Services, Denise Gaida, Auditor Treasurer, Chris Pelzer, Coordinator. And attending remotely will be Chris McCon and Jeremy Klausman of Solid Waste and the news media. Is the news media on?
I think so. Karen, are you there?
Okay, good. Let's stand for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I should say all commissioners are also present for the meeting. Is there any additions or corrections to the agenda?
I have none, Mr. Chair.
None? Okay, is there a motion to approve the agenda as is?
So moved.
Motion by Commissioner Newman, is there a second?
Second.
Second by Commissioner Erickson. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you. Consent items. Denise?
Consent items today are meeting minute approval, November 17th, 2020, appoint Office Support Specialist 1, and appoint social worker.
Okay, you've heard the items. Is there a motion to approve all of them?
So moved.
Motion by Commissioner Kneisel, is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you. Auditor Treasurer.
First item I have is to approve the Commissioner warrants. Background is sent for your review. Recommendation to approve the Commissioner's warrants with an ACH and a regular manual payment totaling in the amount of $171,415.87.
Okay, you've heard the board action. Is there a motion?
So move.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? Not roll call, please.
Commissioner Becker?
Yes.
Commissioner Erickson?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Kircher?
Yes.
Next item is the Health and Human Service Commissioner warrants. Again, background was sent for review. Recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a regular manual payment totaling in the amount of $26,454.16.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Newman. Is there a second?
Second. Second.
Second by Commissioner Kneisel. Discussion? Not roll call, please.
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes.
Commissioner Kircher?
Yes.
The last item I have then today is the Health and Human Service SSIS warrants. Background is sent for review. Recommendation is to approve the Health and Human Service SSIS warrants with a ACH payment and a regular manual payment totaling in the amount of $4,222.29.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, roll call, please.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Kircher?
Yes.
Thank you.
Good morning.
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 Door just opens up for them.
Just like at home. Door opens up. Good morning. Our one item on the agenda this morning for Public Works is our annual request for a project nomination for the ATP, which is the Area Transportation Partnership. This is a federal grant program through MnDOT, through the Federal Transportation Bill that Region 5 basically administers for all the Region 5 counties. A little background with this, we've a number of grants over the last 10 years, and I'll just quickly summarize for the board. In 2016, we received a grant for a CASA 10 project for $864,000. 2021, we got a grant for $973,000 on our CASA 12 project, which is coming up next year. In 2022, we have a project scheduled for CASA 26 for about $451,000. And last year, we got a grant for 2024, fiscal year 2024, on County Road 2 for $1,080,000. So for the last 10 years, we've got roughly about $3.4 million through this program. So with that being said, our request is to nominate a project on County Road 2 from County Road 11 in Candota Township out to Trunk Highway 28 in Birchdale Township in the Ward Springs area. So with that, our options are to approve the attached resolution nominating this project or do not approve this attached resolution. And our recommendation at this time to approve the attached resolution nominating the County Road 2 project.
Okay, you've heard the request. Is there a motion?
Move to approve.
Motion by Commissioner Newman. Is there a second?
Second.
Second by Commissioner Erickson. Discussion. You said from County Road 11 all the way to Ward Springs. So
Correct.
Highway 71 runs between there, so there's going to be two sections.
There's two sections, so we'll pave up to 71.
Okay.
We'll break, move over to the north a little bit as it jogs,
Okay,
and then head east.
okay,
So, yep.
okay, good. All right, any other discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried.
Excellent. Thank you very much.
Thank you.
Lonnie?
Good morning.
Morning.
All right. The reason I am here this morning is to speak to you regarding an update to our contract with the city of Clarissa for us providing their police service. Currently, we have a contract with them for 30 hours a month, and they requested to increase it to 60 hours a month, which would, with the start date of actually today, December 1st. The city of Clarissa approved the contract at their November 16th board meeting.
Okay, is there a motion?
So moved.
Motion by Commissioner Canizos. Is there a second?
Second.
Second by Commissioner Becker. Discussion. Would this adjustment be made in the revenue for the 21 budget then?
You make that adjustment?
We have not made the adjustment, no, but once this gets approved, we can.
So we
We
got,
have finance coming up, so we
Yep,
can
okay.
look at this with our other things we have to look at.
all right, is any more discussion? If not, all those in favor say aye.
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 Opposed? Carried. Thank you.
Thank you.
Assessor, I'm sorry. Morning, Chris.
Good morning. I'm here today to present an abatement for Ed Ziegler. Ed owns a parcel in Ballard Township. His mailing had come back to us as undeliverable and unforwardable. Because of that information, we removed the homestead. Mr. Ziegler recently contacted us and said that he has been living at the parcel since his ownership. He doesn't know why the mail was not deliverable. He has reapplied for homestead, and that's been granted for the 20 assessment. What I'm asking for today is to abate the taxes in the amount of $586, which is the difference between the non-homestead and the homestead for 2018 and 19 combined. So the options today are to approve the abatement in the amount of $586 or to deny. And my recommendation is to approve the abatement in the amount of $586.
Okay, you've heard the request. Is there a motion?
So move.
Motion by Commissioner Becker. Is there a second?
Second.
Kenizel? Second by Commissioner Kenizel. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried.
Thank you.
Just a heads up, Chris, when you do that again, we'd just like to have the township on there so we know where that is located, so,
Duly noted.
thank you.
Thank you.
All right, solid waste, Chris or Jeremy? Okay. Just a minute, Chris, we gotta make some adjustments here, we can't hear you. Sure. Okay,
Thank you for
Yep.
your time this morning, Commissioners. I'm presenting to you the same solid waste management plan that I presented to you several months ago. The difference is that now the MPCA has unofficially reviewed it and told us that if you approve it again, they will officially approve it.
Okay. Huh.
And they suggested a resolution, and I've attached that resolution here.
Okay, is there a motion to, I'm sorry.
Dave, if I could, Chris, on page 84, we got Jonathan as our financial person to contact. Should not that be changed?
I think I'm hearing you, did you say page 84?
Yes.
I'm going there right now.
Okay. And I just, just looking through it last night, it caught my eye. And that's why I was wondering who, went through this. 'Cause I know Chris didn't have any time.
And apologize, I'm having a little bit of difficulty finding, it's not page 84 of the entire packet, it's page 84 of the report.
Yes.
And there was a name change you referred to?
Yeah, it's under financial contact information,
Okay, and what
An
is the name
email?
of this report?
pardon.
What is the name that it says and what should it be changed to?
It's got Jonathan's name on it, and, so, number is 1916. Chris, is that your number?
It is.
Yep.
So we should be changing that, correcting that.
Okay, I'm having some difficulty hearing, but if it's okay, I'll follow up with Coordinator Pelzer after the board meeting, and if we could get, would the board consider approving this with that change?
Yes. I'll see once the board makes the motion in second, but I assume we will pass it, so I'll ask for a motion then.
I'll make the motion and we change that to county coordinator, whoever it is, it's
And should it be a name or should it be a county coordinator, as
I don't think
time
we
goes
should put a
through?
name in there
I think
because,
it's just county coordinator.
And a phone number, so
Don't run into it again.
we don't run into that situation again.
well, as you change staff, then you gotta change that, so. Yep. Okay, Commissioner Kneisel makes a motion with that correction. Is there a second?
Second.
Second by Commissioner Newman. Any more discussion?
Yes, Mr. Chair, this is a revenue-generating document that we have to have for the MPCA.
Yes.
So, in order to get our funding from them, we have to have this done, so.
Right. That's for our SCORE funding, right?
That's correct.
Okay. Any other discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried. There you go, Chris. You're next, Chris, whatever else you had there.
Thank you. The next item is just, we were trying to find a date that the solid waste department could meet with the whole board for like a biannual meeting. And we've presented a few more times here for your consideration.
Well, Chris, we've kind of done the same thing with our public works, but we have not had them because of this COVID situation. Obviously, the meeting room up there is too small. Now, we could have it here, or what we did with our fall meeting is we just had Lauren send out his information to each board member and handled it that way instead of having our meeting. So what's the wishes of the board?
How soon will we be looking into our bonding project at solid waste? And would it be good to have that meeting to update us?
Right now.
On the
we
bonding.
gotta start talking about that now.
Yep. Mr.
Project.
Chair, Chris, is there a date that is scheduled already with, the MPCA?
Right. So I think I heard the question correctly, and so far the answer is we've contacted the MPCA. Jeannie Given is the coordinator for the grants, and her next step is, as she stated about 2 weeks ago, she wants to set up a date in December. It would be a virtual meeting with all the grant recipients, just to introduce them to how that grant will be carried out for all of them. And she specifically said she does not want to meet right now with individual grant recipients prior to that meeting. And I guess I would only add to that as a commentary that I would hold loosely to the phrase meeting in mid-December, that could easily trickle into January. Does that answer your question?
Yeah, I guess so. But, you know, do we need to have a meeting before that meeting, or do we need to have one after it, or?
Mr. Chair, I would recommend after the meeting that Chris has, and myself, I'll be involved as well, and Jeremy, I believe after that meeting, it would make sense to meet. So then we could actually give you some information on what the steps are going forward.
Yeah,
So do you know when you're gonna meet?
No,
Me? Gibbons, not yet.
You don't know,
No,
so,
so it's gonna be sometime in December is what he said.
well, then we don't, shouldn't pick a date yet then, right?
No.
Right.
So we're gonna not pick a date right now, Chris, till we see what happens here in the future, so,
That sounds great. Thank you for your time, and we'll just keep in touch with you.
okay. Thank you. All right. Health and Human Services.
Morning.
We got the B team here, me and Lonnie. Oh, JV, we'll call ourselves. We got the JV. All right. All right, good morning. Again, I'm filling in for Jackie. Our first BAF today is the 2021-2022 Sanitarian Services Contract. Todd County HHS contracts with Morrison County Public Health, as you know, to have sanitarians inspect all of our licensed food, beverage, lodging establishments, manufactured home parks, recreational camping areas, youth camps, public pools, and spas. The attached contract will be for the next 2 years, starting January 1st. This is a modification of the existing contract. The only major change we had to make was around the billing. We are moving to an electronic system for our inspection program from Rapid Inspect, which the sanitarians had used in the past is no longer being supported by the state, to EHDoc, which is within our PHDoc software. But it'll be web-based, which is great. They'll be able to use it in the field. The cost is somewhat significant. The buy-in is $8,000 per year for the next 3 years. And so what we had to do was modify the contract to split that cost with Morrison County. That's the real only significant change to the contract.
Is it an increase?
Yeah, I mean, $4,000. Right now, the way the contract works, we pay our sanitarians mileage and they're an hourly rate.
Okay.
So it always kind of fluctuates based on their time spent in Todd County. But again, we get a fair deal from that. It's just a slight increase of, $4,000 that we can support with our revenue.
All right. Is there a motion?
So moved.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? If not, all in favor say aye.
I,
Opposed? Carried.
Thank you. Our next BAF is a request to hire a health education coordinator. Currently, Public Health is requesting to hire a new health education coordinator. This position will provide community education, outreach, and work collaboratively with our healthcare and community partners. This position is fully funded by current grant funds and is funded for 2021. So the options are to approve the hiring or to not approve.
Okay, you've heard the request. Is there a motion?
is this the one that you guys were here with for,
For work session?
yeah,
Yep, correct.
I'll make the motion.
Motion by Commissioner Kenizel. Is there a second?
I'll second it.
Second by Commissioner Newman. Discussion?
Yes, Mr. Chair. So when the grant funds run out, this position will be eliminated?
Hopefully not. The current grant that we're putting this under, we've had those grant funds for over 20 years in the Child and Teen Checkup Grant. And as you know, we always have additional grant funds coming in. Right now, our problem is we can't spend all the grant funds that we currently have, and we're losing some. So this position will help pick up some of that. So potentially, if we didn't have grant funds available, we may have to lower the FTE possibly, but our goal would be to keep them fully funded.
I had to ask a question.
Sure. I understand.
Okay, any more discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you.
All right, and the last board action today is to give you a COVID update. So we continue to see a significant increase in our numbers. As of today, Todd County had 1,852 positive COVID cases and 14 confirmed deaths. We did have 2 additional deaths that occurred at the end of last week. As of those 14 deaths, just in case you were wondering, 7 were in long-term care and 7 were in private residences. Again, many people with COVID aren't tested, but we are seeing quite an increase in testing. Just in the last week, November 19th to the 25th, we had 1,305 tests performed in Todd County, which, if you think of our population, that's a significant amount. In the last board meeting, we reported about 900 tests. Over the summer and fall, we were doing 400 tests. So I am optimistic that with all that testing being done, we're really doing a good job of catching those who have the virus. So the cases no longer needing isolation is about 85% of our cases. That's calculated as 10 days after they tested symptomatic. So that would be November 21st or earlier. We continue to see a breakdown of males at 46%, female at 52%. Commissioner Kneisel, you had asked if that had flipped from male to female, and it actually has. In the spring, when we had outbreaks in work sites that were predominantly male employed, we had a really high increase of males, and now we're seeing is more females, and that's, I think, just the matter of it's evening out over time. I think that has somewhat to do with the people that work in long-term care, assisted livings, are more female-dominated professions. So, otherwise, I did want to give you a quick update on quarantine and isolation guidance that the CDC has been bringing up, if you've heard about that. The Centers for Disease Control and Prevention is expected to make a change in their quarantine guidance. Right now it's 14 days, right, from your last date of close contact to someone who tested positive. They're looking at changing that. For anyone who's asymptomatic, you would be out of quarantine within 7 days with a negative test. So if you get tested on day 5 to 7, which is typically what we recommend, and get a negative test, you're out of quarantine. Or you'd be out of quarantine if you're asymptomatic at day 10 if you don't get tested. Those who are symptomatic, of course, should be getting tested and, ensure that, but they would stay in quarantine the full 14 days. And then isolation, I just heard this morning might be changing. Again, that's for people who test positive, isolation. What they're finding is that people in isolation, so the day you have symptoms, you were infectious 2 days prior, correct? And then from that day you have symptoms till day 5, so that would be 7 days, is really when you're most likely to spread the virus. Right now, they have you go to day 10 from when you show symptoms or when you're tested, so that would also be looking at cutting that in half. I don't know if that's going to be coming out as soon as the quarantine guidance, but I think the quarantine guidance should come this week. And then the question will be if the Department of Health also aligns with that. So we'll let you know if that changes. It'll be a significant change, and also I think will help people better comply with the guidance. Questions?
Guess not. Thank you.
Like on extra testing, do you think there's been people going to Wadena because they got that free one in Wadena opened up now?
Yeah, we've heard that has actually been very busy. They can accommodate 300 tests a day in Wadena, and they just opened, November 18th. So I think we could see that, and they're doing 220, 230 tests a day. I think the saliva test kits have helped. I think it's just, again, has to do with a lot of community transmission. Families are, seeing that they're testing positive, they're getting their kids tested. And people know, too, getting a test and testing positive sometimes gets you out of quarantine quicker than if you just sit in quarantine, right? So I think it's a good thing people are getting tested. Again, you get 90 days from the day you test positive, sort of an immunity to having to quarantine again if you had a close contact, which is a positive. So I think more people are just getting tested because there's more spread, but also we do have a lot of good testing options, too.
Catherine, I know someone who had it, and I had talked to him here just the other day, and he said he's been going on 3 weeks with fever, tiredness, and everything else that kind of goes with it. He didn't lose his taste or smell, but he says I can lay down and just sleep all day long if I want. But he's been going on 3 weeks now. Is that typical to go that long?
It's not typical. Most people come out of isolation on day 10, but you have to be fever-free for 24 hours. You have to be improving, right? And for an individual like that, they're supposed to stay in isolation if they continue to see their symptoms worsen. Unfortunately, we see a lot of those individuals have to be hospitalized, right? Their O2 goes down, they're coughing, they get short of breath. It's not common, but again, if you have any type of underlying health condition, you can see that.
Well, he is quite elderly, but he was tested and was positive, but he just told me it's been going on 3 weeks. I'm still tired, he said, and I still run a fever in the morning. So.
That is surprising to hear the fever
Yeah.
continue. I've heard people have that fatigue for a long time, and the loss of taste or smell can linger for months, unfortunately, so.
Okay, good, thank you. Anything else, guys? Okay, thank you, Catherine.
Thank you.
Okay,
When does Lonnie speak?
that's the B team. Looks like you got benched.
Go down the bench.
Okay. Do we want to do any closing remarks before we go into the closed session or reports?
I
Yeah.
just have the,
Oh, I'm sorry, we got you yet. I have everything checked here. I was getting ahead of myself. Sorry, Chris.
it's okay.
Go ahead.
So this should be hopefully short and sweet. I have a board action and a resolution to finalize our CARES Act spending. So the board action is to adopt a final CARES Act resolution according to the attached spending breakdown with no funds being returned to the state. The resolution outlines how we have spent our funds. It walks through when we received them, how much we received, the fact that townships received monies, and the fact that those townships and cities received money. They have sent that money back if there was any remaining. And then it talks about how we can utilize the additional funds that were remaining in our fund balance. And I have set those funds aside to be used for payroll, which is an eligible use of those funds. So with all of our CARES Act funds, Denise, if you could maybe bring up that PDF document.
Sure.
Yep. So the county received a total of $3,085,000, and from the cities, we had a return of $14,953, and a return from the townships of $136,354. And so the total that was allotted to Todd County is that bottom figure of $3,151,393. And you can see by the line that's right above the $326,000, that is the remaining funds to be used for payroll expenses as allowed by the Treasury guidance. This will need to be adjusted slightly just because we did have a small business grant that did come in late yesterday, and I was going to bring that for approval this morning, and then we decided it's too late to approve that. So I will have to do a slight adjustment to the small business amount, but this ends all of our CARES Act funding if this board action is approved. And no funds go back to the state.
Okay. For a motion?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Newman. And any more discussion? I would just like to say thank you to everyone who worked hard on this, all the committees and staff, and Chris and Rick and Denise and everybody that worked so hard on this to meet this deadline, because it was very difficult to get things done with the parameters that they gave us. So do appreciate all the work, guys. Okay, all those in favor say aye.
Aye.
Opposed? Carried. Thank you. Now, is there more?
The closed session.
Okay. I was gonna do standing reports before we went into closed session, so if anybody has any. Denise?
Just wanted to comment that we have the Truth and Taxation meeting hearing tonight here at 6 p.m. Please note that by appointment only due to COVID regulations, and the purpose of this is for county board budget discussion only. So we'll see you guys at 6.
6 o'clock. Okay, anything else?
Yes, Mr. Chair. I've been receiving calls, especially with the schools closing and stuff, on dead zones for broadband throughout the county. And it's becoming an issue. And I think that's something that we need to address if we get any more extra funding or anything. We gotta start working on pushing that a little harder.
We've been pushing and nobody listens.
Well, I know, but we gotta push a little harder.
They're finally realizing that, but the schools aren't the only ones facing those issues. It's the small businesses out there in the rural areas
Correct.
that don't have the right broadband either, so, or fiber, so. And we've been doing this since I've been a commissioner, and you too, that we've been pushing this with our legislators, and nobody wanted to listen to us. All of a sudden, well, guess what?
Yeah.
We have a big need now,
Mm-hmm.
so.
So,
Okay, anything else? If not, we will go into closed session. The commissioners will hold a closed session pursuant to Minnesota statutes 13D.03 to consider strategies for labor negotiations. Do I have a motion to close the meeting?
So move.
Second by Commissioner Becker. Is there a second? Moved by Commissioner Becker. Second by
Second.
Commissioner Kenizel. All those in favor say aye.
aye.
Hello? Back on.
They don't wanna be.
There's somebody there.
Was there?
Yep, it's on.
Recording? Yes?
We're missing
Randy's
Randy
not
though.
Oh, Randy's
Yeah.
there, but that isn't on though.
I called and told them.
It started.
Okay.
Yep, the streaming's on.
I gotta wait for Randy. Taking a break.
That's something how they,
Yeah. Especially highway. I'm just
huh?
a little shocked at highway. I really am. They've been pretty easy going lately. I should say of previous. All right, I will call the regular board meeting back into session at 10:11 a.m. on the 1st of December. And with no other business, is there a motion to adjourn? I'm sorry, we will recess until the 15th of December. Thank you.
Thank you.